You also came up with a very novel way to adjust the proximal contacts of a crown prior to cementation. In fact, I don't know that any dental school teaches this, and I don't know, that anybody else is talking about this. It's a really unique way to do it, and it involves you actually adjusting the contacts in the patient's mouth with the crown in place,
Right.
which makes so much sense when you see it for the first time and go, "This we should be doing this in the mouth and not out of the mouth." But at the time, the only abrasive strips that you had to do this were these long handheld strips.
Right.
You were telling me about a time that you placed a crown on a patient that looked really nice, and you were getting ready to show it to the patient, and you noticed something on the patient's lip. What had
Right.
happened there?
It was really disaster for me, but the disaster turned to the opportunity for better dentistry, actually. The patient, I was sitting the crown. I used to use the long strip to restore the interproximal relief, so make the crown complete marginal seating. And when I finished the crown, the cementation, it was done beautifully. Beautiful crown, complete marginal seating, and interproximal relief, restored. Everything's perfect.
It
So
couldn't
I'm
have gone any better.
So happy.
Right.
So I finally, the David is all done, and I was now going to show him the mirror.
Right.
And then suddenly I found some bleeding on the lip. So I was, what is that? And then I realized that I cut his lip using the long strip.
Right.
I was so embarrassed, and I was so sorry. So I apologized for him, and he said, "Oh, that's okay, it'll be healed." He was a nice man. But for me, it's so much.
It bothered you way more
The
than it
more,
bothered
more
him.
than bothering, is kind of a traumatized.
Right.
How could I do that? So that is a start pointing, developing the interproximal
Right.
relief, the strip.
Yeah, the strips that you've become famous for creating, well, we could probably trace it back to David, right? And
Right,
that,
yeah.
that cut on his lip where you instantly looked at it and realized he hadn't bitten his lip. It was a
Right.
cut that was the shape of the long strip.
Yeah,
that
I
you
was
just
so
used.
much concentrating on the crown.
Right.
But usually I do really carefully, but I forgotten for the lip. So long strip cut the lip.
Right.
Yeah. So now it's a short strip in my 2 fingers. It's very safe and work fine. So no more
Right.
accident like
Well, that's
that.
perfect. And thank
Yeah.
you to David and his lip for providing the inspiration for you, because otherwise Contact Easy might not exist if it wasn't for that mistake. So it's, there's an old saying that you don't learn much from success, right?
Right.
It's the
Right.
failures that provide an opportunity to learn. So let's talk a little more about that crown seating technique, because being in the lab for almost 20 years, I'm very interested in talking to dentists about how they seat crowns, because from the lab side of it, you see a lot of complaints from doctors about having to do too many adjustments to crowns.
Okay.
And then a crown will come back with an open contact. So the way I was taught to adjust crowns in school prior to cementation was to try it in the mouth with a piece of articulating paper between the crown and the adjacent tooth, mark the spot, take it out, and then use a handpiece and a burr and make the adjustment and try it back in again. And you'd go back and forth, adjusting it out of the mouth,
Right.
putting it back in, hoping that you didn't over-open the contact. But you would almost always change the shape of the contact.
Right.
And even if you got the contact perfect, now you had to polish it. So you were going to remove some more,
Right.
and the contact might get too light. And that's, I think, how it's still being taught at most places. But you actually do it where you place the crown and then you try one of your strips, one of your interproximal
Right.
strips on both sides to see which contact is tightest.
Right.
And then you'll make buccolingual strokes back and forth, like
Right.
5 and 6, which is removing
Right.
some of the glaze, right, from the crown itself.
Right.
And so this is how you go about seating crowns, right?
Right.